I'm truly honored to be with such an esteemed colleagues and healthcare worker from all the facilities from M42. Thank you for this opportunity and thanks to coming to Arab Health. So today we're going to navigate the medical tourism in UAE. And we are here in Dubai, in the largest conference that covers healthcare in the region and brings people from all over the world. In Dubai, we have over 180 nationalities. And that is the topic today, thinking of. When I was preparing for this session, I was thinking, why would a patient from any other country would choose UAE to come for medical tourism? So I'll start with you, Samia. First, welcome.
Thank you very much.
Yeah.
Good afternoon, everyone.
So can you tell me what initiatives are being undertaken to promote the UAE wellness and medical tourism here?
So to answer your question, UAE has already established itself as a medical tourism destination with all the state-of-the-art and facilities, with all the talented physicians that it attracted. It has attracted all the renowned names of facilities, including Cleveland Clinic Abu Dhabi. When you think about the UAE, or you think about, or let's say UAE is not only a destination for medical procedure, but it is a curated experience. In the UAE, we are moving away from the conventional or from the transactional healthcare towards a more holistic approach of wellness, where we nurture body, mind, and spirit. For example, let's take a patient that's coming to the UAE for a surgery, a complex surgery. So what they anticipate is an OR, sterile environment, physician, and focus only on the treatments. In the UAE, when patient comes, they are faced with a totally different reality. It is state-of-the-art facility. It's the most talented physician in the country, and combined and blended with wellness and most, I would say, luxurious retreat environment. So, and Abu Dhabi, of course, is aligned with that, with the strategy. You have the wellness strategy 2031. You can see also a partnership emerging between healthcare facilities and wellness centers, so that they can provide that amazing experience where patients not only come from treatments, but they also learn and empower them. They are empowered to take care of themselves. At M42, as a global health champion, we're definitely aligned with the strategy of the country. And I can give you just a quick example. We recognize how menopause is an important stage, crucial stage in the life of women. So in 2024, last year, we've launched a dedicated clinic for menopause, where we empower women to manage the symptoms and also how to take care of their lifestyles during that stage. There is also the microbiome wellness program, where we acknowledge the importance of the gut health. And again, we empower people, we teach them, we guide them on how to manage their gut health through a program of diet and lifestyle.
Thank you, Samia. So I think in summary, you mentioned that we have the knowledge, we have the expertise, and I think we added up also the investigation centers and the latest technology using AI. So this is all here in one place. And we have, of course, the expertise that we're gonna take one by one. So moving to Dr. Waleed Hekal, who I think you moved or relocate from United Kingdom after
25.
25 years, yep. So you chose UAE to continue your healthcare journey. So tell me, why would the patient, specifically scoliosis patient, would choose UAE to do such service?
I was looking at the top 10 countries in medical tourism. Actually, currently, Dubai is number 6, Abu Dhabi is number 9, only preceded by Canada, Singapore, Japan, Spain, and UK, in that order. Scoliosis is one of the hot topics in spine surgery. It has to be executed in highly specialized deformity centers. When I was in the UK, were only 23 centers providing the service. And we are now providing that both at HealthPoint and then at Al Emirat. So for somebody to leave his own country and to go to another country to have this highly specialized surgery, he is looking for many things. One will be the clinical expertise of the surgeons providing the service. And we are the only unit, I guess, in the whole of the UAE where 2 deformity surgeons are doing the operation at the same time. And that has reduced our operative hours to within 3 to 4 hours, where it used to take much more than that. When we talk about the innovations and the new techniques, we have done a case recently in Danat Al Emirat, a 7-year-old girl with early onset scoliosis. We put what we call the magic rod or the growing rod, which is a magnetic elongated rod. Many years ago, we used to do the conventional technique and taking the child to theater every 6 months. Now with this technology, we can operate once and do the lengthening in the outpatient clinic, which is a painless procedure, till the child reaches skeletal maturity. Then we do the definitive fusion. There are too many things which can attract also patients to come in terms of the technology, the use of something called EOS machine to give the best outcome in radiology with the minimal exposure. And of course, the use of navigation, whether it is CT-based or the robotics. And we are now in the process of purchasing one because that is the top notch. That is the highest level of providing the service, which is not less than any country in the whole world. And it's not, by the way, available in every center in US or UK.
Thank you, Dr. Waleed. And I think you mentioned a very important point, where is the location of UAE in the globe. So it's in the center that allows patients from all over the globe easy access, where they have difficulties with some other countries and visas and travel. And also, I think the welcoming nature of the UAE and their population, it also welcomes their tourists, their patients, which also provide an area and atmosphere for a good recovery. Thank you, Dr. Waleed. So moving to Danat Al Emirat with Dr. Summia. So can you tell me what would be specialized in women care in Danat Al Emirat that they are looking for, the innovation in their care and the service, and what are the specialized services provided in Danat Al Emirat?
Thank you, Iman, and good afternoon, everybody. So I think the question that you started off with, Iman, saying why would someone come to the UAE? Why would a patient leave their home country, their familiar surroundings at a time when they're most vulnerable? It's not an easy thing, but I think the answer really lies in what we've seen here in these 4 days, what M42 has to offer. We've heard each day, even more fascinating innovations, more fascinating collaborations, more fascinating developments. At Danat Al Emirat, we are committed to meeting the needs, the unique needs of international patients. And we're particularly focused both in women's and children's. I know you mentioned women's, but women and children hospital. And that's really down to our expert clinicians who come from a diverse range of backgrounds and training, including the US and the UK. So what we've done so well is have that expert clinicians, but it's not solely due to our expert clinicians. Some of us have mentioned, and I think actually my pediatric team who were here earlier today mentioned the term transdisciplinary care, which is a whole nother level from multidisciplinary. So it's no longer different disciplines dealing with patients and then emailing each other about those patients. we deal with very complex cases, and Dr. Waleed spoke to us about that. So he's an expert in scoliosis surgery, but why he comes to do his surgeries at the Net for the Children is because of the whole comprehensive service that we can offer for patients, our pediatric intensive care unit, our nurses who are specialized in looking after pediatric patients, because children are not just little adults. They have their own unique needs, their own unique requirements. We have pediatric anesthetists who can safely put a child to sleep and deal with any complications that might be required. And looking after children in that way, we can give them the best care, we can give them timely recovery. And so obviously we at Danet, we can offer complex scoliosis surgery, but Dr. Abdullah Al-Jinebi, who is our head of department, also mentioned about our achievement in offering the first patient in the Middle East treatment with teplizumab, which is a medication that can delay the onset of clinical type 1 diabetes. So again, this is placing us at the forefront for innovation in diabetic management for our patients. And this was an international patient. So we offer, and I know Samia is heavily involved with this, we offer patients that come to us a really tailored approach. So that's right from meeting them at the airport, arranging accommodation, really holding their hand throughout this really stressful time for them. If you imagine when you're coming to a strange country and you're really giving your complete faith and trust into these people, you want to be completely taken care of, and that's what we can offer to patients. In terms of women, we launched here at M42 our unique new offering this year, which is ovarian tissue cryopreservation. So we're anticipating a huge demand or uptake for this in terms of a unique offering for international patients. The Danet Al Emirat will be the first hospital in the Middle East to offer women a chance to delay the menopause by being able to conserve their ovarian tissue and reimplant it at a later stage and be able to have their own natural production of hormones for much longer, so they're not having to rely on artificial hormone replacement therapy. And of course, we're a center of excellence for endometriosis surgery. Now, endometriosis is a huge chronic condition that causes massive morbidity internationally, and waiting lists are huge. I mean, I left the UK where waiting lists were 2 years for women to receive treatment for endometriosis. Here in the Emirates, we can give them timely access to that really a complex treatment that will give them their life back. These women live with chronic pain that affects their lives terribly, and so they can access this timely care. And of course, our multidisciplinary approach with all of our allied professions, physio, speech therapists, behavioral therapists, respiratory therapists, all of this gives them that enhanced recovery afterwards.
Thank you, Dr. Summia. And I think you mentioned exclusively in this session the announcement of the treatment that is done for one of the international patients. And I think this is going to transform the treatment of type 1 diabetes here. And hopefully we're going to get more international patients doing that. Thank you so much. Moving to you, Dr. Esmaeil. And I know that you just made it on time before the session. And if you allow me to
Still
share,
breathless.
Yes. So if you allow me to share with the audience the secret behind it. So he just did a case of international patient, and that was why he just made it on time. So if you can tell us about this.
Absolutely. No, thank you very much, Iman, and good afternoon, everyone. You're absolutely right. So actually, today the plan was to leave 11 o'clock, make it well in time over here. But as nature has it, there's always other plan. We had an international patient that actually came from Sudan who needed emergency treatment. I already had 5 cases booked to have surgery in the morning. So I'll finish them and should have been here on time. But unfortunately, because we had this patient, we had to finish that patient, fit him in. And alhamdulillah, the surgery all went well. And I managed to just about literally find out the 29 I was just standing over here. So Allah sallam, inshallah sallam.
Okay, if you could tell me, how does Moorfield will leverage the expertise in ophthalmology to attract medical tourism looking for an ophthalmology care?
Thank you very much. So actually, Moorfield has been playing a pivotal role in providing medical tourism since its inception over 250 years ago. As we all know, Moorfield is one of the oldest eye hospitals in the world, established in London. and it is a charity hospital. So what they noticed over the past few decades in London, that there was a lot of patients coming from Middle East and Africa and many other countries. And of course, these patients are not well, they have eye problems, and there's a huge distance for them to travel. So they actually put together a strategic plan, what they could do to really more so to provide excellent care to these patients, but also to make it more convenient and give them a full experience. And they came with obviously different options, and after going through the options, the clear winner for a location was absolutely UAE. In particular was Dubai back in 2007, when the first Moorfield outside London was established, which basically not only we could give patients a great clinical care, but also combine it with, exactly like you say, with the welcoming nature of UAE, the connectivity that I have, the network, the infrastructure, and also that hospitality that UAE has basically. I think since then, the rest was history actually, and Moorfields Dubai has grown to a huge team and have been providing huge number of medical tourism as well as expat and UAE national. And as the Dubai story was becoming more and more popular, they obviously looked into another location, and that was Abu Dhabi, so to create again more personalized experience for the patients in Abu Dhabi. And Moorfields Abu Dhabi was established in 2015, 2016, and again we have already outgrown ourselves, and actually we're in the process now to move to a much larger location and hoping to be able to provide that expert clinical care. But what Moorfields also done, not only providing excellent clinical care, but concentrating a lot on other areas like education and research. And actually Moorfields, starting from Moorfields London, they have discovered many of the eye medication, including some of the most commonly used eye medication, including a steroid for the eyes. It was actually discovered in Moorfields. So we're actually very, very proud to be part of that. And even I myself, I was in UK for over 25 years, like Dr. Waleed, and I came back about 3 years ago. And actually one of the best decisions I have made coming over here, looking at the environment and seeing the patient from different places, but also getting that excellent experience. And of course, that makes UAE a very nice place to attract talents. Because the most important thing of any place is, if you're really, really good place, you've got all other areas of expertise, you need to be able to attract talents. And we've been very, very lucky that we'll be able to get a very highly qualified team of doctors, nurses, admin, which works very, very well like a clockwork, basically, to provide that excellent care, basically, and attracting and hopefully providing care to people from all over the world. Thank you.
Thank you, Dr. Esmaeil, and we're so lucky to have you, Dr. Summia and Dr. Hekal came all the way from UK to here. We have the expertise, and our patients are growing internationally. So I'll go back to you, Samia, since you are taking care of all the patients seeking our healthcare here. So since we are M42, so we integrate AI and technology a lot within our systems. So can you tell me like how technology is supporting medical tourism?
So technology has completely transformed the medical tourism. So in the past, patients, obviously, it is already difficult to navigate treatments and care at your own home, let alone when you travel. It's very daunting. So it would take a lot of time, a lot of money for a traveler or any patient to look for a physician, to look for a healthcare facility, to make payment. They don't know what to anticipate. But technology has transformed the fragmented experience, patient experience, to a more seamless and easier journey. So today, the patient, even before he sets foot on the plane, technology has started working for him. Let's start from and we'll take, of course, the at M42, the International Patient Service Department. As soon as the patient starts contact us, which is, we call it the pre-travel or the pre-consultation stage. We offer them telemedicine. They get to know their physicians. They build that trust. They understand their treatment care. So when they they start planning their trip to Abu Dhabi, they do it with confidence. There is no fear. They know who they're going to deal with. Once they arrive at Abu Dhabi, the technology is still enhancing the experience. They meet with their physician, then we go to the procedure. So at M42, we have robotics, we have innovative technologies for minimal invasive procedures. Then we have, before even they go back home, you have the EHS system that there is a safe, they can securely transfer information and data between healthcare provider or between physicians. We have the wearable devices to monitor remotely the health of the patients. And even when they go back home, a lot of patients cannot afford to come back for their follow-up consultation. Again, telemedicine, so that the physicians follows up on them, and so basically even though it's a combination of the team hand-holding the patient and technology.
Thank you so much, Samia. So I think, as I mentioned earlier, we have the knowledge, we have the expertise, and on top of that, the technology. So we're building up our patient. Thank you so much to the esteemed panel. It's open now to the audience if you have any questions. And maybe, Samia, it's worth to share with them, like, if any of the audience, their colleagues, their family members, they have a patient abroad that is seeking any service at M42, how can they reach to us?
So you have our information across all the websites of M42, Danat, Moorfield. You can contact us, and we are available 24 hours, 7 days a week. You have the team of International Patients Ambassador who will take care of you throughout all the journey.
Thank you so much. Any questions? So by that, we are concluding our session. Thank you so much again, and see you next year.